These distinguished men and women, very, very important people. I'm humbled. When I look at the desk of the panelists, I see even one of my mentors, Rachel Kitonyo. She's there. Seeing her baby talk, yeah, it's a wonderful thing to see you are grown and speaking before people about such serious issues. I'm told also we have some members, honorable members of parliament with us. I don't know who they are, but I'm sure they are here. And others from the ministry, from the Tobacco Control Board, and our youth are also here well represented, the people I value most, the Gen Zs who are going to force us to change if we don't want to change. So they are the agents of change, and therefore we must change before they change us. Those who have spoken before me have said very important things, and therefore I start from where they left. The Kenya Tobacco Control and Health Promotion Alliance has been in existence for some time, and we had to change tact and start operating a bit differently from the way we started by bringing on board all those that matter. Because initially it was just those that were handling tobacco control that were coming together under the alliance, but now we discovered that for us to have proper fruits, we were to bring on board those in the education sector. And that's why I'm a teacher, and I'm here talking about this. And the Ministry of Education is normally with us, the Teacher Service Commission, those who handle curriculum, because we cannot keep talking about having tobacco control content in the curriculum without involving them. So we normally sit with them and discuss these issues. We do a lot with those in the health sector, because we say that sometimes you find those who are really abusing drugs, and especially tobacco and alcohol, are those in the medical field. And therefore we must talk to them. And being the people that are going out there also to handle these issues, they must go out having known exactly what they are going to do. And that's why we are also going around the Kenya medical schools, rather the Kenya Medical Training College campuses all over the country, training peer counselors in them so that they also take part in what we are doing. Also building the capacity of the CSOs, and even government officers, like the enforcement officers. We've done it even with the legislatures, MCAs, and sometimes members of parliament. And therefore, we must bring everybody on board. That's what we are trying to do. My elder here has spoken about being on at the grassroots with the community, and that is what we do most. I personally stay in Busia, although my home is in Kakamega, and there's a lot that we do down there. And I'm happy that an elder like this one is able to recognize that and tell us. You know, there are some people who only know that Nairobi is Kenya and Kenya is Nairobi, and they are Kenyans, so all that they do and glitter is within Nairobi, and then they feel that they've served the country called Kenya. We must think better and reach outside there to those at the grassroots. For us to succeed in doing whatever we are doing, there is a lot of need for political goodwill. If our leadership doesn't support whatever we do, we can't go far. And that's why even WHO really looks at the relationship between the CSOs and the government. And if there is a very little going on, then sometimes even WHO withdraws. Like in Tanzania, where they have not even signed the FCTC, whatever, there is very little going on. And it is actually really letting this area down, this region down, because we cannot do much together. So what we are saying is that we are calling upon the government of Kenya, and especially the Minister of Health, to participate in whatever we are doing fully, because that has been a bit of a problem. And I'm not afraid to say that this could be going on in other countries, as we've been sharing on the social media platforms, that there is a lot of confusion within the government, there is no coordination, and when that happens, then it becomes hard for us also to do what we are supposed to do. Because we are to be guided, to be given directional guidance by the government. So anytime the government doesn't play its part well, then there is a problem. Tobacco industry is very good at derailing what is happening, delaying whatever legislation that is in place, and even ensuring that it destroys whatever we are doing. So as we talk about even reviewing tobacco control policies in the country, it is my sincere prayer that we do a lot of monitoring and countering what the tobacco industry is doing. There is a lot of interference. And that's why we have gone through the process of coming up with graphic health warnings, changing whatever was there into a better thing, and then after that everything goes quiet. You go through a legislative process, come up with whatever you want, and then silence takes over. Whatever you have done is put under the carpet because of industry interference. So I'm praying that all of us will monitor. We are going to talk. There are some CSOs which even no longer behave like CSOs. When you become a bit hard, they withdraw and even say, we are not part of that, because they want to look good. I want to tell you that we must stand up to be counted. That we tell the government this is not the direction to take, we are taking this direction. So to be very fast, I would want to say that for us, in the civil society world, we are saying that the changes that are coming must include the total ban on novel and these emerging tobacco and nicotine products. We want them banned from this country. Our neighbors are complaining that Kenya is the gateway. These products are coming from out, then they go through Kenya into these other countries which have even banned the products. And therefore, if we want to look like we are really contributing positively, because we were even the first ones to sign the FCTC in this sub-region, or in this region in Africa. And therefore, we must also provide that kind of leadership by ensuring that we don't open doors to these products that go into other countries through us. And even to worsen things, we are also going to give BAT that space to manufacture, not just to import. Because BAT said there is a lot of market. We want now just to manufacture and spread all over this kind of thing that is going to destroy the children of Africa. And the Kenya will be our launching pad. We are going to spring from Kenya and destroy Africa. And then they have continued to pressurize the government to give them that space, trying to twist the government because we are so desperate for investors. We want manufacturing to grow in the country, and therefore they tell the government, if you don't accept, we are going to withdraw our investments from the country. So as to ensure that the government allows them to produce these products that are meant to kill the children of Africa, to have our children reduced into zombies and die earlier than they are supposed to. So we are saying that our parliamentarians, some of them, especially in the Senate, have come up very strongly to speak about this. I salute Honorable Sabina Chege for speaking very boldly about this. I salute Honorable Mumo for coming up very seriously. And the people who have really been instrumental in our parliament, like Dr. Namai, we have had Dr. Nikal, and the former parliamentarian Gor Sungu. These are people who stood with Kenyans. And that's why we have the TCA, Tobacco Control Act, the Tobacco Control Regulations, and other policies. We want to see such people standing up with Kenyans. So as we even discuss this, we must remember that we have that duty of ensuring that we protect the lives of Kenyans, that our children must be safe. And as we talk about taxation, we are emphasizing the idea that taxation on tobacco and nicotine products is meant for public health, for health, not necessarily revenue. Forget about this idea of fellows coming up with the figures that they are focusing on revenue. No, we are talking about public health. And we know that a healthy nation is a wealthy nation. If we want to reduce that disease burden on our economy, then we must reduce supply and demand of these products that are causing sickness. So it is a long-term solution to whatever people are trying to do. Instead of looking at the revenues that are being brought in by these harmful products, we can focus further and ask ourselves, what are we going to gain by ensuring that Kenyans are healthy? We are going to get more. So that is where our focus must be, and that's why we say taxation on these products must go high. It must go beyond even 75%. And I'm very happy. At one time when we were talking in Naivasha, and our brother from the Kenya Revenue Authority promised that the KRA was going to do something. And it had done it in the past finance bill. We saw it, walking the talk. So we want to have such kind of people in our country. We have had a lot of pressure from the industry telling the government that these products are safer and therefore they should be treated leniently. They should not even be taxed heavily. That lie from the devil. We don't want those kind of things to come in and continue to suffocate our country. But when you see things going very slowly, we keep on rotating around, reviewing the Tobacco Control Act. We continue going round and round, then you know who is behind that. But we are going to move forward. We help each other. We hold our hands together and move forward as a country. And as I conclude, I pray that those battles at the Ministry of Health will also be taken care of, so that we have people who are united, working together as a team, as we join them as civil society organizations. I have so much to say, but I cannot say it here now. I believe those who will be talking after me will also cover some ground. Thank you so much, and God bless you.